everyone, welcome to the webinar. I'm Christine and I'm here with our surgeon, Dr. David Kirkpatrick. During the webinar, please send any questions that you may have if you're on the website through GoToWebinar. It's in the chat box. If you don't see the chat box, go ahead and click the orange arrow and that'll direct you to the right spot. And if you're joining us through YouTube, there's a chat box directly embedded into YouTube.
Awesome.
So let's get started, Doc.
How are you?
Hey, I'm doing good, Doc.
Good. Let's get started. So hopefully you guys are all on here to learn about implants. If you're not, you've clicked on the wrong webinar. Anyway, we will get going. A little bit about me. So I'm originally from Kentucky, did all my school at the University of Kentucky, except for surgery. I did that at University of Florida in Jacksonville. And I am a board certified oral maxillofacial surgeon, which is very important. One of the most important things that you're going to get from this webinar, whether you come here for me to treat you or you are being treated at another clinic, make sure whoever is treating you is a board certified oral surgeon. It's the only way that we we get to not police ourselves, but make sure that we're all up to the same standard of care, to make sure we're all doing the right things in the best way possible. So that is a very important thing to get from tonight's webinar. So we've got a couple new surgeons that we're going to talk about that we're very excited about having them join us here at New Teeth Now. The first is Dr. Kate Vorwald. We're very excited to have her.
You're so lucky.
You know, I know. You know, I was going to just go into it. So she originally was working after residency and very skilled at Moffitt Cancer Center. And, you know, she's doing a lot of complex head and neck cancer cases and decided to take kind of a different route and a challenging route too. I mean, head and neck cancer is very challenging, but what we do is, it's just a little different. And it's more of elective where, you know, with cancer patients, it's something that there's a dire need. And she was treating patients that, you know, have a malignancy or something that needs to be taken care of right away and in a certain fashion. And with this, you know, you're getting to treat patients and do a really nice service, but it's on a totally different level. It's more elective and it's helping in other ways where you can totally change somebody's life from, you know, replacing the teeth from their appearance to function and health. So we're very happy to have Dr. Vorwald join us. We also have Dr. Natalia Nunez, who more recently joined us. She joined us in the beginning of January, and kind of the same thing. She was working in a private practice office and decided that she wanted to take a little different route and do sort of the New Teeth Now procedure. So she joined us, and once she's trained and comfortable, she's going to be going to the Villages location. So we're very excited about having her join our team. And I know the people in the Villages are counting down the time until they get her there. Because you even told me before we started the webinar, like, hey, when's she going to be in the Villages? We've got people ready to schedule consults and procedures.
They're excited.
So that is very exciting for us here at New Teeth Now. So the locations, we kind of talked about that, but we have our main location here in Lakeland and our second location in the Villages. There are the two buildings. And to kind of jump into dental implants. So for those of you that do not know what an implant is, they are recommended by our National Association as the best way to replace missing teeth. And there's what an implant looks like. So it's this silver structure that looks like a screw that you can see on the picture. And the implant goes into the bone, which replaces essentially the root of the tooth that either gives us or your dentist a foundation to put the crown or the bridge on. And really what we do here in our New Teeth Now procedure is replacing everything in one jaw or everything in both jaws with implants. And how we do that is we put 4 to 6 implants in the lower jaw, pretty much 6 implants always in the upper jaw, and that's how we replace everything with implants. And if you can, and kind of keep the screen on the computer for a little bit so we can kind of run through these slides and show people what we're talking about. So this is how we do the upper hybrid. You can see the 6 implants that are kind of ghosted in the image, and those are essentially securing the entire bridge for the upper reconstruction. and we do something very similar on the lower. You can see this lower hybrid has the 6 implants, 6 spread evenly throughout the jaw, and then the bridge secured on those 6 implants. And when we do that, that is a very stable, non-removable, totally implant supported that never comes in and out unless we or your general dentist take that bridge out, like you can see on the screen. So throughout this procedure, we're going to show different before and after pictures and a few videos of patients kind of giving their testimony and kind of what they went through when they came here for treatment. And I think that is kind of powerful for you guys at home to hear not only me talk about the implants and what we can do with that, but actually patients that I have treated have undergone the procedure and kind of what they went through in their perspective. So the first is Miss Gloria. And Gloria is a patient that, very unique circumstance. She was involved in a car wreck when she was in her teenage years, ended up knocking out and traumatically damaging a bunch of her teeth. And she had a dentist back then create her some type of appliance. It was like a denture that snapped on over what you can see there with her before roots and teeth that are left. And that worked for her for a little bit, but she got really tired of having something that would come in and out. So she wanted to know if she was a candidate for implants. She came to see me for a consult. And after my exam and looking at her CT scan with her, she had plenty of bone for implants. So we were able to take out the remaining teeth, roots, and put in implants. So I'm gonna let her tell her story.
The car accident I had was tragic and lost everything. Just all down to nothing, like gums. And after that, I went to a dentist and I got a plate just to fit up there. And then I would use adhesive to hold the upper plate to keep it in place. And I would have to do that like every 2 to 3 hours. Go in the bathroom, put my adhesive on and sort of stay up there to keep it from, it fell out a couple of times, but I was like surprisingly hit it, and just kept my mouth closed. I spent a year looking for a dentist that would do what I really needed done and right now. And I found Dr. Kirkpatrick. So then I came over at 7 o'clock in the morning, and about 4 o'clock I was going home and I had teeth. And I'm like, oh my God. Now I'm able to chew my food, I'm able to taste my food, I'm able to swallow my food and smile. I can smile as big and pretty as I want to. And I thank Dr. Kirkpatrick for making that happen.
Okay, so beautiful smile.
What an amazing
I
transformation.
know, and it just totally, it's almost like a different person, the before and after.
Oh my gosh.
And that is something that, with her before picture that you can see there. I always have patients to give me, try to give me their best smile for a before picture. And, she's like, oh, I don't smile. I don't want anybody to see my teeth. And that's a pretty consistent remark that we hear from a lot of our patients. But so I was like, well, I've got to have something. Just give me what you got. So she was kind of making a face at me with the before picture. But her after, beautiful. And if you watched her in the video, just seeing how she was talking with her teeth, so much more confidence than she had with her removable denture. It's just, pretty cool to be a part of her process.
So life-changing, Doc.
Definitely. So why new teeth now? Definitely number one should be to restore your total body health. Mm-hmm. The number one reason anyone should think about doing this procedure is for health. I mean, it's for health and function mainly. And then you get the benefit of the appearance of them. You do get to play a role in picking out, what the teeth look like with your temporary teeth and your final set of teeth. And we'll talk about those in a minute. But number one should definitely be to address oral health and function. Definitely improves self-confidence, brings out a smile like you could see in Gloria, improves your ability to eat, which is the functional part. And then the asleep during the entire procedure, a lot of different offices and clinics will advertise and talk to you about, well, yeah, you're asleep when you have this done, but you're not really in most places. Here you are truly asleep. You're under general anesthesia. We have a separate anesthesia team that comes in, which makes it, in our opinion, the safest and the best way possible to do this. And it allows us to not only just focus on the surgery and not also on the sedation part, but when you're under general anesthesia, your airway's protected with a breathing tube, which is the safest way to do this. And then we can focus purely on placement of the implants and not worry about, well, gosh, they're not sedated enough because they can feel me pulling on the cheek, or I can't get the implant in the most perfect position because they may be feeling some of this because I can't give them more sedation because then they may stop breathing on me. But when we can control that, then, and you're under general anesthesia, we don't have to worry about that. So it makes it the best way possible for me to be able to get the implants in the most perfect position. And it's the safest way possible because we have a separate anesthesia team and your airway secure. And that's a question that we do get asked, like, well, what's the difference between like you and this other implant clinic? And I think we had a question that did come in as the webinar was starting, like, what makes you different than Clear Choice? Well, that's a big one. I mean, that's one of the biggest reasons that we are different than Clear Choice. All our patients are under general anesthesia with our true anesthesia team here. You're not sedated, and so there's a few things that we'll go ahead and talk about. The general anesthesia, you're treated surgically by board certified oral surgeons, which typically at other places you're not. You're treated by probably by general dentist or other type of dental specialist. And we also believe that general anesthesia is not only the best way, but being treated by a board certified oral and maxillofacial surgeon is also the best way and safest way to do this. And then the difference between what we do and what most other clinics do is your final teeth are made out of zirconia, and that is huge long term. It's hands down the most cosmetic and the strongest material that anyone has to fabricate or make these final bridges out of. So, we feel that patients will be happier longer and have something that truly can last a really long time if they take care of them. They're designed to last you forever. The only person that really knows that is one person, that's you as the patient by taking care of them, and us doing the best we can by putting your implants in. And then the postoperative pain level, I throw that on here because it really does surprise us, because it surprises most of our patients. We give you a couple different types of pain medicine. One is a narcotic, but it is routine for patients to tell us that, well, you gave me the narcotic and I did take one the night after surgery, but I never really needed it, so I don't know if I ever should have taken it or not, and I just didn't take it the rest of the time because I never had that much pain. You are uncomfortable if you get swelling, but we do give you ice packs and recommend that you keep ice on the outside of your face, pretty much all the time for the first 2 to 3 days. And that makes a big difference with the postoperative discomfort. So the oral body connection, I'm gonna kind of go through this really quick, but most people know now that periodontal disease can affect a lot of other organ systems, including your heart, lungs, increase your chance of diabetes, make your diabetes more uncontrollable. So there's a big connection between periodontal disease and the rest of the body. And we all know that. It's well documented in the literature. And here's kind of what it looks like. The before picture, all that darker yellow stuff that you can see above the crowns of the teeth, those are roots. That's root structure. And you see that because the bone has shrank away, the gum has receded up from periodontal disease. So you can start to see that most of those teeth are a little loose because they've lost a lot of the bone that surrounds them. And that's what it looks like. And that is a disaster from a health standpoint, because that periodontal disease is a low-grade chronic infection that your body's constantly fighting and trying to repair itself. And it never can as long as the teeth are there. So as long as the source of the infection, which are the teeth, are still there, your body will never get rid of the periodontal disease, even with antibiotics. And this is after. Took the teeth out, placed the implants. That's about a month afterwards. Nice, pink, healthy gum tissue with no infection. And this is his before and after. And you can see, you know, he looks different too, you know, a really big smile on the after picture. And the main thing with that, not only does he look better, but he's infection free. So if you want to be truly healthy, you must address your mouth and, you know, treat any type of infection that you have. So who's a candidate for this? Obviously, if you have no teeth, you're a candidate for new teeth now.
Yep.
If you're unhappy with your dentures, you're a candidate for this procedure. Mouthful of bad teeth, mouthful of periodontal disease, and especially if you've ever been told that you do not have enough bone for implants, then you really, I would highly recommend that you come see me or Dr. Richards or Dr. Vorwald for a consult to see, just to let us take a look at your CT scan, get a good oral exam, because I've yet to have a patient in the 15 years that I've been here that I could not do this procedure on because they didn't have enough bone. Some of the things we can do with the zygomatic implants, it's amazing how you can treat things that other people cannot, just by being able to use the zygomatic implants. So that's a really cool thing to be able to offer patients. So another patient, you know, kind of same story, periodontal disease, lots of pain, lots of infection, and I can't really see it because we're kind of far from the screen, but there's a little area on his gums that he's got like this little, looks like a scab on his gums, but it's a communication from an infection where one of the roots are that has eaten its way out through the bone and the gum and starting to drain into his mouth. So that's just, you know, that's a bad infection, and it's never going to get better until the teeth are taken out. And here's his before and after. And just amazing.
Just it looks
you know,
phenomenal.
Yeah, very happy guy, very outgoing personality, but with his after, I mean, just, you could just see he was glowing. When he would come in for his post-op appointments, he was in the theater, he had a matching hat and shirt every time he came in.
Awesome.
And he was just wanting to show people what, you know, his implants, his bridges, and just how good they look. He wanted to show them off.
That's amazing. He looks so different.
And then this lady, dentures. She'd been, you know, her before picture looks okay, but they're dentures. And she hated the fact that she had to take those in and out. She had to use denture adhesive to hold them in when she was eating. And it was just a mess that she was tired of dealing with. So she came in, and she had also been to another clinic where they told her that she was not a candidate for implants because she didn't have enough bone. But obviously you can see on the after picture, we were able to place implants using zygomatic implants for some areas where she was missing bone, and able to have screw retained bridges placed that do not come in and out. Another patient, dentures, you can see her upper gum tissue, and then the lower, she had had 2 implants placed years ago, and they were starting to fail because she had not just an upper denture place, but she had a lower, in the dental world, it's called an implant overdenture. So it was like a denture that would snap on to the 2 lower implants. And she was, over time, the repeated motion of placing that on and off, and then constantly just took its toll on those 2 implants, and they started to fail. Because it wasn't something that was screwed in like our new teeth now, where it's screwed in and is never removable. These, when you're constantly putting something on and off the implants, it's rubbing on the gums, it causes the bone to resorb a little bit, and over time those implants start to fail. So she had been to 3 or 4 different other places, had been told by pretty much everyone she wasn't a candidate for more implants. She just needs to get used to her dentures. Came here as a last resort, and she was totally expecting to kind of have that let down once again and me tell her that she didn't have enough bone. But with the zygomatic implants, she was definitely a candidate. We were able to let her throw away her dentures here in our office. We made new implant supported bridges, implants, secured the bridges. They do not come in and out, and that allowed her to have teeth that she can function with without having to worry about them coming in and out, not using denture adhesive, and also the aftercare. You treat these like natural teeth. So you use a toothbrush, toothpaste, water pick, and you do go get your teeth professionally cleaned every 6 months. And then this young lady, all of my patients I feel like are special patients. You know, and we build a relationship with most of our patients because we do get to know you. You know, there's a few appointments with, you know, the couple appointments before the surgery, and then you have your surgical procedure, and then there's some post-op appointments with me, and then the follow-ups where you come in and have your teeth cleaned with a restorative team. And so we do get to know patients more on a personal level, which I appreciate. And, you know, this lady, she came in from one of the New England states in the northeastern U.S., and she had been to a bunch of places as well, where one of which she had this full arch bridge placed on her natural teeth. Started to fail, and you could literally grab that with your fingers, her upper teeth. It was one big horseshoe bridge, and you could move it up and down. It was at any day going to fall out of her mouth. So she had passed up no telling how many oral surgeons and surgery centers and implant centers between all the way, you know, in the New York area to get to Lakeland to see us, who had told her that she didn't have enough bone to do the implants. So we evaluated her. She had plenty of bone to do implants. We were able to place actually 4 traditional implants, 2 in the front, 2 in the middle, and then you can see those 2 longer implants that are going in an opposite angled direction. Those are the zygomatic implants. And we were able to very straightforward, predictably get her a very solid foundation that we could screw in this screw retained bridge. And that's her after picture. And just totally, you know, I mean, her teeth are exactly what I would pick. You know, some people will say, well, I don't want the really Hollywood white teeth. She obviously did, and I love that she picked that because I think they look beautiful.
They look stunning.
You know, she was very happy because now she's got a bridge in her mouth that she doesn't have to worry about at any time breaking. Okay. And this little video kind of shows exactly what the zygomatic implants look like as they go into the lower part of the cheekbone, which is your zygoma, and that's why they're termed zygomatic implants. And then you can see the bridge there being screwed in with the 6 small titanium screws that secures the bridge on those implants. So I think it's a pretty cool video that shows
it's a pretty great diagram.
How these work. And then that is a before picture. So the before picture, very, very little bone in the upper jaw. And really without zygomatic implants, this patient would either have no option having, you know, implant supported bridge, or they would have to undergo some type of extensive bone grafting where we would take bone from either the lower part of the leg, the hip, or use an abundance of cadaver bone and place there and hope that enough bone takes with the bone graft to place implants, you know, 6 to 8 months after the bone graft. And then you got to let the implants heal for another 4 to 6 months. But with zygomatic implants, we can totally avoid the need for the bone grafting procedure. You can avoid having to wait on the bone graft to heal, and you can place the implants in 1 day and hook the teeth up in 1 day. So it's really been a game changer for us and our patients. So another lady, and we do get this question occasionally, like, well, will I ever need a root canal again? Because I had a root canal 10 years ago, and it was the worst experience of my life, and I don't want to have to go through another root canal. Well, with implants, they're fake, obviously, so you do not ever need a root canal on the implants, and you can't get a cavity on the implants. So they're very easy to maintain, like we talked about earlier. Toothbrush, toothpaste, water pick.
Oh, Dr. K, it looks like we have some questions.
Great, this is a perfect time. I'm going to change, well, no, we'll go right here.
Awesome.
Perfect time to
So one of our first questions is, how can you extract someone's teeth and then put in implants if you have to put an airway in during the general anesthesia?
That's a great question.
Let's do it.
So someone's kind of thinking about this as we're talking about it, because you would think that the airway would go through the mouth, which most do, except for most head and neck procedures. So when I'm doing a lot of trauma at Lakeland Regional, So with facial fractures or a lot of facial trauma, the airway is always secured through the nose. So there's specialized breathing tubes that actually go through the nose down, into the airway. And it's the same thing as putting the breathing tube through the nose, except we just access it through through the mouth. We just access it through the nose. And that allows us to have free reign of the mouth without any obstructions being around. So great question.
Perfect. Well, Doc, there's also another question about general anesthesia. So this patient is 64 years old and he's never had general anesthesia before throughout any surgeries. If he signs a waiver, can the procedure just be done with just local anesthetic, like Novocaine or lidocaine?
Not here. So it would be something that would be very difficult to sit through awake.
Yeah.
Even under, because like we talked about earlier, even under IV sedation, it's something that's the way I used to do them. 15 years ago when I started, me and Dr. Richards and Dr. Musser was still here at that time, and we were doing these solely under IV sedation, and it was a nightmare. We still got the job done. We still were able to make patients happy and do the procedure, but it was very difficult. You constantly felt like you were struggling with the verge of too much sedation and being unsafe with the sedation versus not enough sedation, and the patients were, not really tolerating or wanting me to get as far back as I need to get to put the implant in the best position. So when we started doing this with our, bringing in an anesthesia team and doing it under general, it totally was eye-opening with how safe you could do it and how perfect you could get the implants. So never again will I do it under sedation, and I wouldn't even contemplate doing it under local anesthesia.
Gotcha. And it's more safe, comfortable for the patient,
Oh,
right?
it's way, you go to sleep, you wake up, and it's over. But it's something that I think you would have a really hard time setting through. And if you were able to, there's always a give and take to pretty much anything we do in surgery and pretty much in life in general. And if you are, awake, if you could talk someone into doing this procedure on you while you're awake, there's something that they're going to give into that's not going to go exactly the way it should or could if you were under general anesthesia. They're going to cheat a little bit with one of the implants, being too far to the front part of the mouth and not as far back, because there's no way you can sit through that.
Yeah.
Like, there is no way. I do this procedure every day, and we've been blessed to do this procedure as much as we do. And, from the experience of doing these, there's just no way.
And I feel like as a surgeon, you're so much more relaxed, because I've got to see other surgeons do surgery and the patient, is under oral sedation, and I can just see how stressed they are.
Oh, it's a constant battle with, doing the right thing and being safe and still getting a great end result. And when it's an awake patient or sedated patient, getting a great end result is almost impossible.
Gotcha.
Yeah, but great question. But I would highly recommend that you would think that through before you would allow somebody to do that to you awake.
Oh, it looks like we have another question that just came in, Doc. This potential patient is terrified of implants going in their upper jaw. So they want to know, what is the pain after, the amount of pressure that they'll experience?
Okay. So, if you consider the amount of work that we do when we do one of these cases, whether you have no teeth and we're just putting the implants in, or you have a mouth full of teeth that just have, they're non-restorable, a ton of decay or bad periodontal disease, and we take all the teeth out and then put the implants in, patients actually do really well. And it's surprising to us, but we see it all day, every day. And what I would tell you is, when I was still doing a lot of wisdom teeth, my wisdom teeth patients had more postoperative discomfort afterwards than my patients where I'm doing a complete mouth reconstruction with implants. And it's just, there's a lot of reasons for that, because we know we're eliminating all possibility of infections. We're taking that out, we're cleaning everything, and we're completely closing any incision that we've made. So there's almost like a watertight seal around everything. So your chance of a dry socket is, I don't even remember when I've had a dry socket with a hybrid. I mean, it's been, more than 5 years that I've had one. And, you know, patients do, now don't get me wrong, you're definitely going to know that we spent a couple hours together in the operating room. But mostly it's patients will just tell me, like, if they get, I tell everybody to expect some bruising and some swelling. And most people get that, some do not, but I tell everybody to expect it. And I tell every patient to go out and buy like 8 or 10 bags of frozen vegetables. We give you ice packs, but like a bag of frozen peas really conforms to your face well. And, you know, if you go, right when you go home, you start putting one bag on each side, and as soon as they start to lose their, you know, that extreme coldness, rotate it, put it back in your freezer, grab 2 more bags, put them on your face. And if you do that and you keep those on constantly for the first 2 to 3 days, the pain level is, there's just not a lot.
That's
I mean, we give pretty much my cocktail of prescriptions to give for patients after this is 800 milligrams of ibuprofen. So it's a prescription strength ibuprofen and Percocet, if a patient can take narcotics. And with those, I tell patients to start the ibuprofen the night before your surgery, and then you take it continuously every 8 hours for the first 3 days. And when patients do that, the ibuprofen's plenty to cover their pain.
Doc, can you kind of explain to me, like, what is the effect on this? Because this patient has not had molars for about 40 years, and he or she just utilizes only their front teeth. They're thinking that it's pretty easy to get used to having, like, is it okay, is it normal and quick for them to adjust to having that many teeth now versus what they had before?
Yeah, for the most part, actually people I think do very well with that and are more comfortable once they get so in the dental world, you really want to have to, not only for your chewing capabilities, but to protect your TMJs, you really want to have a stable occlusion with back teeth. And these bridges are designed to go from first molar to first molar. So when you close, you have all your back teeth touching pretty even on both sides. And when you stabilize the bite like that, it usually makes patients more comfortable. Even patients that, you know, maybe like the person that asked the question, that only has front teeth and have probably adapted to only having the front teeth there. But I would think you'd be more comfortable and it'd be something easy to adapt to with going back to a first molar.
Gotcha.
Good questions.
I think that's all of our questions for now. We can get back to it.
Well, hey, keep them coming. If something comes up, send it in. Yep. We'll keep going with the slides. So we did have the one question, what made us different than Clear Choice? And I don't really like to name other clinics or surgeons or different places that do this procedure or try to do this New Teeth Now procedure like we do. And pretty much there are some key differentiators that do make us different. And we've kind of talked about this already, but there are 3 huge things that, you at home, you really need to understand this, that being treated by a board certified oral surgeon is the best person looking after you from both a surgical standpoint, a health standpoint, and a safety standpoint. We by far have the most surgical training of any specialty. I mean, in your residency, we are all over the face. And that's something, so it's not just the mouth. And I think that's really important, especially if you need zygomatic implants or you need some extensive bone grafting, to know the anatomy as well as we do. And a lot of the medicine that goes into the general anesthesia, it's just these 3 things truly separate us from most of the other clinics and facilities that do this full arch implant reconstruction. Another thing that's here is everything is under one roof, which if you've never had this type of procedure done before, then you really probably can't appreciate this or understand this very well. But to have your consult. I mean, the people you talk to on the phone are here, you know, and then to have your consult here, your impressions here with our restorative team, your surgery is done in this building. The lab is here. So like your teeth are actually made here at New Teeth Now. And your final teeth, like everything is designed and made with people that are in and about this building constantly. So to have the ability to have, you know, like not only me as the surgeon or the restorative doctor or, you know, our implant coordinator who you will get to know pretty well, and then the lab technicians, to be able to have the full team come and look at you as the patient independently, to look at just everything you have going on, from just like your skin tone, like your skin color is different from mine, your facial shape is different from mine, and that all plays a role in getting these things not only to fit like inside your mouth and be, you know, appropriate width of your teeth, the arch of your teeth, but just how they look on your face and how you can function with them. And then the all-in-one day, this is a really nice thing to be able to offer patients.
Definitely.
So your procedure, now you would have to come here for the consult. So everything's not done. You don't come for your consult surgery and get your final teeth in one day. But you'd come here for the consult. But your surgical procedure, any basic procedure that you're having done is done in one day. So your teeth will be coming out, your implants will be put in, and your temporary teeth put on same day. The temporary teeth are made out of acrylic, or we've got a couple other materials that we can make the temporary teeth out of, and that's determined kind of when you're here for your consult with discussions with me and the restorative team. And then the final teeth are always made out of zirconia. Zirconia, like we talked about earlier, by far the strongest and the most cosmetic appearing material that we or anyone else has to make these final bridges out of. When you do come in for your consult, the first thing we do is obtain a CAT scan, which is called an iCat, and that really lets us see what you look like on the inside from a bone standpoint. And we use that, and you look at the CAT scan with me when we're going through it during the consult. So you'll see what I'm looking at. You'll see why I would say I can put an implant here, or you need a zygomatic implant here. And we do that together, and that helps us develop a treatment plan that, you know, me and your implant coordinator will go through with you. But it's kind of cool because it's not just me or an implant, because we do hear that when patients come here for second opinions, they've been somewhere else, and, you know, they've had an opinion, and they're like, well, the surgeon really only spent like 5 or 10 minutes with me, and the implant coordinator was going over everything with me, and they just kind of told me how much it was, and I don't even really know what they were going to do to me. Well, when you leave here, you're going to know exactly what my plan is to do inside your mouth to get you to your goal of having fixed implant retained bridges. And not only will you know about where I'll place the implants, I show you on this the CT scan where the implants would go, and it's different with everyone. And then with the teeth, you know, you'll get to hold little models of, you know, actual copies of teeth that we've done for patients that we have, you know, in the consults that you can hold and see and feel and look at. And that, I think that really helps kind of give you a lot of information to where you can make a good decision to whether this is the right procedure or not for you.
I mean, I've sat through your consults, Dr. Kirkpatrick. I feel like you get very in-depth, and the patient, I feel like almost the patient could go home and explain to like their spouse, like what is going on. Like,
and sometimes I'll actually joke around and be like, okay, like you're actually certified now to read a maxillofacial CT scan.
I feel like they can.
Because
they're giving so much information, which is awesome.
As much as I went over it with you, then definitely you got an idea. And most patients will tell me like, gosh, I see what you're talking about. Yeah, I know why you would do that. Like I can totally see I don't have enough bone for a regular implant, so you need to put a zygomatic implant.
I feel like they can get your pattern of thought.
Yeah,
like,
they can.
Oh, it looks like we have
Just cool.
2 questions that popped in. So Kathleen wanted to know, how do you help a patient who currently has GI issues, for example, ulcers, IBS, and they cannot take any ibuprofen?
Well, there's a lot of different other drugs that we can utilize other than ibuprofen. And we got a lot of patients that, for various reasons, and it's mainly because of some type of GI problem that you can't take, ibuprofen or NSAIDs. But we talk to you about that on an individual basis. Usually we would be talking to your primary care as well and determine kind of a correct, regimen to follow post-operatively. But there's a lot of different other drugs that we can utilize for patients that can't take that.
Many options.
Yeah.
And then it looks like we have another question where, have we ever considered using nanoceramic for the bridge?
Yes, and it is not the best. We've considered a lot of different other materials. Nanoceramic was one of those. And it just, nothing, at the end of the day, nothing holds up to the test of time of zirconia. From, like I said, appearance and strength, it's just nothing is even in the ballpark of it yet. And we try to stay on the forefront. That's why we even looked at nanoceramics in the past, and we thoroughly evaluated them, tried them on a few, and it's just, they're not in the same category.
That makes so much sense. I feel like our lab is always on top of things, and they're always constantly streamlining the process.
And we're still looking.
Yeah.
We're always looking, and our lab manager, Jack Garcia, he's very high tech and on, loves the technology side of the lab side of making and fabricating these bridges. So he's constantly coming to us, and like, there's scanners that we're looking at that actually scan so you don't have to take impressions in the mouth anymore, and especially with materials. But there's just nothing out there. And he's going to all these different, lab meetings, and there's nothing out there yet not even anything really close on the horizon to challenge zirconia. So we're just, we're going to keep using zirconia and still make patients happy with that for.
And I think they're pretty happy.
As long as we need to, yeah. Until something better comes out.
Yes. Perfect. Well, I think that's the end of our questions for now.
Okay.
So we can get
Well,
back.
we'll go in, and I'll let you guys see our implant coordinators. This is Shauna, Allie, and Mara. And we have very recently added Crystal, who we're very happy to have part of our team as one of our implant coordinators. All four very well trained, very knowledgeable about the procedure. So much so that when I come into the consult, I'll usually start talking to a patient about, the CT scan, and they're like, "Oh yeah, Shauna showed me that." And I'm like, "Okay, so here, well, here's your sinus, and here's this, and here." "Oh yeah, Mara already showed me that. She said you were going to talk to me about that," which is really nice for me to hear, because that means that they are taking a lot of time with the patient before I even get in the room. So then I come in and pretty much reiterate probably exactly what they have said, and kind of go a little bit more detailed about the surgical side. But they're very knowledgeable and can make patients feel comfortable with what's going on, and kind of answer a lot of questions even before I get in the room.
And that must be so nice for the patient too.
Oh, it is. So. And that's one of the reasons that a lot of patients say that they did get a lot of information, and they were very happy with how the consult was done here at New Teeth Now. And a lot of patients will actually make a comment on the side and be like, "Gosh, the other two consults I had, they didn't go over anything with what you did. Like, I didn't know that that's the reason that they told me I couldn't have an implant, or they didn't even mention a zygomatic implant." And so it is good to hear that. It's sad in a way, but it's good to know that our team is doing the right thing for patients. But it is a little disheartening that everyone else is not.
Yeah, it's unfortunate. But.
Yeah. So our restorative team, Doctors Nafala, Dibbs, and Sorrento, it's kind of the same song and dance like our implant coordinators. They've been here for a long time. They're very knowledgeable. They're extremely good at what they do. And one of those three will be who you will see with me when you come here. And they do the restorative side. So they will make your temporary teeth, which I use in surgery as a guide to place the implants. Then I place your temporary teeth that same day, and you're my patient for about 6 months. And then I turn you back over to whichever one of these doctors that made your temporary teeth, and then you're with them to make the final teeth, and they help you with all the aftercare and the cleanings afterwards. And I'm gonna let Dr. Dibbs share his opinion of what it means to practice in a facility like this one, where everyone is in one building. You know, he's with the lab, has full access to the lab and the surgeons, and how that helps him get the best result for our patients.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. We need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
To have everything under one roof. There's no wait-in. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists. And they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
All right. So, and then this is another exciting part of our practice that's, new things. We have actually a dental milling center that is purely dedicated to milling and making zirconia bridges, which is super cool because there's very, very few places, actually, not only in the US, but in the world that has something like that. And I would doubt that there's not another oral surgery or full arch implant office that has anything like that. I mean, it even blows my mind when I see the thing working. There's these just gigantic machines that are constantly milling these bridges, and when you see it, it's like they call it a puck of zirconia. It's like a hockey puck.
Yep.
And it's just zirconia, and they put these discs in the machine, and the machine starts milling them out, and they are perfect. And they have to be, otherwise they wouldn't fit your implants.
Yep.
So that's very, very cool. And then this picture, and then there's a couple questions came in. So this is me and my team, and you'll definitely get to know Amanda, Zoe, and Monica if you come here for me to treat you. And they've been with me for a really long time, all very, very good at what they do, very experienced. And kind of like with me, I mean, this is pretty much what I do, full arch reconstructive surgery every day. And those three girls are there with me every day. And, I kind of joke around. It's really, really nice to have them, and they're trained as well as they are and as smart as they are. But it's almost scary in a way because sometimes I'll be doing something on a patient or getting to a certain part in the procedure, and I'm getting ready to turn around and ask for something, and they've kind of they're just got in their hand waiting for me to grab it. And I'm like, how'd you know I wanted that? So, but it's good because it makes things run very efficiently, and the more efficient that we can be in surgery, the safer and the better overall the procedure is. So I really do like having my team. I probably don't praise them as much as I should, but I definitely
They'll
don't.
watch this.
Yeah, I hope they're not watching tonight, but they are very good, and patients love all three of them when they come in for their post-op appointments.
That's so perfect.
And then here is our entire team, and it pretty much, you heard the term. It takes a village to get things done, or it really does take the entire team to make this machine work, to be able to produce, good results for all of our patients day in and day out. And I think we have, before we get to Juan, who I'm excited about, we have a couple questions.
Yeah, I think we have a couple questions.
Okay.
So the first question is, how long between the final and permanent stages, and then is sedation required for the permanent placement of their final teeth?
Okay, so typically we do wait somewhere around 5.5 to 6 months between surgery and starting your final teeth, starting the fabrication process of the final teeth. And there's some really good reasons for that. Some facilities will they've actually tried to market against this, which I think is hilarious. They'll say like, well, if you go to new teeth now, they're going to make you wait 6 months before you get into your final teeth. And we're like, if you don't wait 6 months, you're going to be super unhappy when you get your final teeth too early, because your gums are going to shrink and you're going to get this gigantic gap between your bridge and your gums, that your spit and everything you eat and drink is going to kind of flow underneath, and air can escape when you're pronouncing certain syllables. And unless you know that, you would think, well, I can go over here and get my final teeth put on 2 weeks after surgery. Well, that's great, but you're going to be calling that person 3 months later, want to know why you've got this big space there. It's going to happen. That's the way you heal. That's the way our bodies are designed. So when you do this procedure, the day I put in your temporary teeth and do your surgery, if here's your gum level, your temporary teeth are made to go up and touch the gum level. As you heal over the next 3-4 months, your gums are going to shrink. They're healing. They're shrinking down and tightening up around the little abutments that secure the teeth to the implants. We know that's going to happen. You can't stop that from happening. And when that happens, we like that because you've got a space that's very easy to clean. You can pretty much just swish water around in your mouth and help get stuff out. You can water pick, you can brush it, and it helps you keep everything really clean, which makes your gums heal the best way possible. You'll hate the space, and patients tell me all the time. I really kind of address this during the consults, but patients will come in like for their second, third post-operative visit with me, and they'll be like, I'll ask them like, hey, Christine, like, how's it going? Oh, it's great, Dr. Kirkpatrick. Like, everything's great, like no pain. I'm loving my teeth. My family brags on how they look, but I've got this space, like this big gap that developed. I'm like, remember I told you about that in the consult? And they're like, yeah, but like air escapes. Remember I told you about that in the consult? And that's one of the main reasons that we wait the 5.5, 6 months to start making your finals. And what we do is take the temporary teeth out at that 6-month appointment when you're starting the finals, and take new impressions, which recaptures your new happy, healthy gum level. And that's what that level is what your final zirconia bridge is made to go up and touch again. And then your gums are stable. They're not going to shrink anymore, and you will not get that gap recreated there. So you're way happier. It may sound like, oh, I've got to wait 6 months to get my final teeth. But nothing would be easier for us than to give your final teeth the next day. Then we're done and we wouldn't have to see you again. But we know it's not the right thing to do, and there's a better way to get you, something that you're going to be really happy with. And then the second part was, are you sedated for the, no. The only thing that you're sedated or numbed up for or anything like that is the surgery day itself. Afterwards, there's no pain. There's no reason for sedation or anything like that with, any of the follow-up appointments with me or any part of the final teeth process.
Perfect, just one time. And then the next question, Doc, is if the oral antibiotics cause or complicate this particular person's GI problems, can they have antibiotics prescribed intravenously? This patient is an RN in New Jersey.
Okay, that's a good question. So we give you, everybody gets kind of just like any other outpatient surgery center or how I treat my patients at Lakeland Regional here in the trauma center, but everybody gets prophylactic IV antibiotics. I mean, right when the IV goes in, you're here for your surgery day. We give that, so that goes in, and then it's typically, while we're getting everything set up and cleaned and cleaning your mouth out, just getting things ready, a good probably 20, 30 minutes goes by. So it gets that IV antibiotic a good time to circulate through and just have everything set from an antibiotic standpoint against developing a postoperative infection. We do give oral antibiotics to take for about a week afterwards. Do we need to do that? There's been patients that I've not done that for various reasons. Either they were allergic to pretty much every antibiotic except one IV form of something, so we do that. But I do give a topical antibiotic mouthwash that's called Paradex. It's chlorhexidine mouthwash. And really with the IV antibiotic dose that we give you before surgery and the Paradex rinse, if you have a really hard time with oral antibiotics, that's all you need.
Yep.
Just
Gotcha.
keep everything clean, use the oral antibiotic rinse, and you'll probably be fine. And I would recommend starting with that other than going through the process of having like a home health set up to where they would have to come to your house and do IV antibiotics.
And then the next question, Doc, is if this patient needs help with hotel accommodations and transportation to and from our surgical center, would we be able to help them with this?
Yeah, that's just part of the process here, and that is part of our, it's like the transformation vacation when you come in. So definitely our implant coordinators are the people that you talk to on the phone. They're very knowledgeable about that, and there's a lot of different hotel options very close to the office. And we even have some transportation that can get you to and from there, from the hotel to the office as well.
And I think we also just because we do have so many patients traveling, I think we do partner with a couple of hotels in regards to like discounts.
Oh yeah, we
so
do.
It's pretty cool.
We do. So there's a lot of information there's a lot of information on our website, but you can, if you call in, we can definitely help with coordinating and scheduling some of those reservations.
Perfect. And then our last question in this thread is, how long does it take to get used to the feeling of the prosthetics in the person's mouth?
It's such a different, it's a different process for every patient. And most patients, I would say, they really get acclimated to these things pretty fast. Typically about the second or third month. And the reason I know that is there's a couple different times during the recovery that I actually unscrew and take the bridges out because I want to look at your gums and make sure everything's healing the way it should. The first time I take them out is around about a month after surgery. And at that time, patients are almost really excited about getting their teeth out because they want them out, they want to brush the gums, just kind of get some type of relief, they think, from having the teeth out. So we'll take the teeth out, I get a good look at the gums, make sure the incision totally healed. That's usually when I'll release you as well to start using a water pick because I get a good look at the gums. And then we take your teeth upstairs, we let the lab smooth, clean, disinfect, and polish the teeth, and then we put those back in. And when those teeth go back in, patients are like, oh wow, those feel really good going back in. And that's the last time that patients usually ever want the teeth out. Because when I take them out the second time, which is right before I release you to start your finals, you can see patients. I'll walk in the room and they're sitting there with their hand over their mouth and they're trying to talk to me. I can't understand what they're saying, like you probably can't understand me. Yeah. And they're just like, when are you going to put the teeth back in? And I'm like, I just want you to check your gums, they'll go back in. And I'm like, why, does it feel really weird without the teeth in? It does not feel good at all without my teeth in. I never knew how bad it would feel if these bridges are not screwed in. And they're like, no, it doesn't feel good without the teeth in. I want them back in now. So we know the patients get used to and adapted to these teeth very quickly. And they're way before, I release you to start making the finals.
That's perfect. Well, I think that's the end of the questions that we have for now, so we can resume.
Perfect. Well, I got one more patient that I want you guys to hear from. He's got a unique story, a very cool story, and kind of talk about his stay with us here at New Teeth Now.
I am different. I was born different. My adult teeth weren't growing in. And when I went to the dentist said that it was partial endodontia. You become extremely self-conscious. You're always looking down, looking away. You can't hold a conversation more than maybe 2 minutes before somebody looks you in the mouth, and you know, it's always that stare. And they can't help it, it hurts. It's very hurtful. I'm 35 years of age and waiting my entire life to find a procedure. I finally found it, and it gave me the opportunity to change my life.
Oh boy.
See that?
Oh my goodness.
I thought it would be good, but this is phenomenal. The staff, you feel like family. Everyone here knows you on a first name basis. This is more than I could have ever imagined. Now, it's the confidence of speaking to someone and having conversations, and not having to look around to see if someone's staring at me, and just looking at someone's eyes and seeing them look you in your eyes is an unreal feeling. On my airplane ride here yesterday, I had a long conversation with an individual that was sitting right next to me who also was from Chicago. Then the lady in the aisle joined in on the conversation. I realized the entire time that I was looking at them both. They were looking me in my eyes, and we were having a whole conversation for about an hour, and I would have never done that in the past. One of the ladies said, "You have such a beautiful smile." To me, it's a whole new world. I had a really good feeling that everything was going to turn out in my favor, and it did. I know every day I'm going to smile as big as I can for no reason because of New Teeth Now.
All right, so one before and after, and actually this after picture, like that's taken surgery day.
Well, that's
So
gosh.
he's obviously awake, and he's probably ready to go home for sure, because he spent the day here with us, undergoing the procedure and then waiting on the lab to make the temporary teeth. But that's him with his new teeth screwed in his mouth, ready to leave the office the day that we did this. So, I mean, he just looks great.
He does.
So the process here is essentially just a very kind of simple diagram that shows exactly what patients go through when they come here for our New Teeth Now procedure. First appointment's consult, then you come back for your pre-op and impressions. That's where we get the molds to make your temporary teeth, which I use in surgery. And then you can see the New Teeth Now surgery, the post-op appointments, and any adjustments that you may need. And typically there's about three post-op visits if everything's going kind of as planned, and most of the time they do. And then start and place the final teeth. We start the making of the final teeth about 6 months later, like we talked about for the gum shrinkage, and it takes 5.5 to 6 months for your upper jawbone to fuse with the implants. And we really want everything healed before we start that. And then the care and the maintenance is just like we do with our natural teeth. Every 6 months you come here, we take the teeth out, clean everything, get a good look at your gums, make sure everything's healed, not healed well, but very clean with nothing irritating the gums. And you do that every 6 months, and if you do that and you're taking care of them and you're doing your professional cleanings every 6 months, these things are designed to last you for your life. So we have a lot of good resources that I'll probably let you talk about if you want to, where patients can get some really good information.
Yep, perfect. All right. Alrighty guys, so we have a really great YouTube channel. If you type it in YouTube, it's New Teeth Now, and it's just, there's a plethora of information on there. You'll see a lot of Dr. Kirkpatrick's previous webinars. You'll also see Dr. Richard's webinars on there as well. And so it's really just a great way to start, that you know that you'll be getting viable information. So yeah, check out our channel. It's pretty easy to get to, and it's also plenty of information for you to start there. Thank you guys for joining us.
Thank you, Christine.
Thanks, Dr. Kirkpatrick.
Hopefully you guys got a lot of information, all your questions answered. If not, I know questions always come up.
Yes.
Just go to the website, newteethnow.com, call in, and we will definitely get you answered your question over the phone, or even hopefully schedule you for a consult.
Well, thanks everyone. Hope you have a good night.